The birth process is successful when everything is ready. You have a vital sow who eats well, drinks well and doesn't have a fever, and your piglets are vital and have drunken their bellies full with colostrum. You recognize a good expulsion phase of the birth process, which means the time between the first and the last piglet born in a litter shouldn't take longer than 5 hours. The normal time between 2 piglets should be 20 to 30 minutes. How do you recognize Dystocia in a sow? You can recognize this by looking at the litter. When all piglets are dry, it means that it has taken a long time since the last piglet was born. The other way is by looking at the sow chart. If you note down regularly the time and the number of piglets present in the litter, then you can see whether extra piglets are born since the last check. When do you do a manual check during the birth process? First, when you see a sow pushing and no piglets are born. You also do a manual check of the sow when the birth process takes too long and you just have a couple of piglets born. When already a lot of piglets are born and you have doubts whether the birth process has ended, you start with giving an oxytocin injection. But always check the sow within 15 minutes after injection whether the placenta is born or another piglet is born. If neither of those two happened, you should check the sow manually. How to do a manual check? First, clean the vulva because you don't want to bring dirt into the birth canal. Second, use gloves and lots of lubricants because you don't want to hurt the sow and cause lesions. And third, don't go too deep. It's not necessary to reach for the nose of the sow, it's just necessary to take out the piglets who are stuck in the birth canal, the vagina and the first part of the uterus. When you take out a piglet, always check the umbilical cord for bleeding, and when they bleed, just tie a knot in the umbilical cord. After the manual check of the sow, always end with the oxytocin injection, and preferably inject them intramuscularly and not in the vulva. The birth process ends the day after all piglets are born. Then you have to check the sow that you held manually, if she eats well, drinks well and doesn't have a fever, because a vital sow is the best LifeStart for the piglets.